Hello and welcome. You're watching Herald TV, and this is a special show on medical fraternity, Dotor In The House. Yet again, we have with us Dr. Sheldon Pereira, a physiotherapist who has passed his graduation from the KLEs in Belgaum in 2006 and a master's from Mangalore, having a vast experience of 16 years and currently practicing at Physiologic, his own clinic of the Bambolim Santa Cruz Old Highway. You can visit his clinic for all your physiotherapy needs. And today we will be talking to him about strokes. Welcome to the show, Doctor.
Thank you, Shoaib.
Doctor, the first question that normally arises is what a stroke is. So if you can tell us whether there are various types of stroke or is it just one kind of a stroke that we can talk about?
So basically when we use the term stroke, in the medical terminology, we actually mean cerebrovascular accident. So what happens in a stroke is that, if you try to define it, it's actually a focal neurological deficit. Now to break it down into simple terms, it's like a particular area of the brain that is not receiving a blood supply, or something that is pressurizing or compressing it can produce a stroke. And now basically there are two types. One is called as ischemic and the second one is called as hemorrhagic. Ischemic means mostly the cause is a clot that blocks, occludes the blood supply beyond a particular point to that particular part of the brain, and the brain, that particular part of the brain starts malfunctioning. And in hemorrhagic, the blood vessel, it ruptures, it breaks.
Doctor, I'll just interrupt you on that because we have a question related to that. So our viewer also gets that benefit. So we have a question from our viewer.
Yeah, sure.
Hello doctor, my name is Rana and I want to know how one can get a brain stroke, like what causes a brain stroke.
And then related to that, there's a specific question on brain hemorrhage, just what you were supposed to speak to us. So let's take that question too.
हॅलो, माझें नाव दीप्ती नायक. डॉक्टर, म्हजो प्रश्न आसलो की ब्रेन हॅमरेज कित्याक म्हणून जाता, सो तेजो मेन कारण कितें आहा, की आमी स्ट्रेस घेता म्हणून ऑर आनी कितें?
Okay, we'll have to club in.
Yes.
So basically when she asked for the causes of stroke, we do not exactly say as the cause, but we use the term risk factors. Because risk factors is something that increases or predisposes an individual to get a stroke. We cannot specifically say that this is the only reason why, unless and until, like for that particular individual who has suffered a stroke, then we identify the cause and then we name it. But generally speaking, like risk factors could be many. The first risk factor that we have found out to be the most common is actually mostly lifestyle disorders, like your diabetes, then it could be hyperlipidemia, any heart related issues, sometimes even kidney related issues, because it can interfere with the blood pressure and with the metabolism of the body. And habits like smoking, excess alcohol consumption, then obesity, living a very sedentary lifestyle, and sometimes also genetic predisposition. That means certain individuals, if you look at their history, their familial history, they do have a strong history of strokes. So these are generally, you can say, the risk factors, or commonly what we call as the causes of stroke.
Just a what I should say, medical issue that I would question, because a lot of times people talk about strokes in general terms. They take it also for their heart attacks. So is referring to a heart attack a stroke is the right thing to do, or should be a cardiac arrest or heart attack, what it should be?
Actually, technically, when we say stroke, we are especially speaking of the brain.
It's exclusively of the brain?
Yeah, exclusively for the brain. For the heart, there are so many. Though some people use the term heart stroke. But when we use the term stroke medically, according to the medical dictionary, stroke is related to a event of the brain.
Coming back to our main topic, and that is about stroke. So what are the first signs if somebody, I'm sure is it very spontaneous, or is it a gradual thing to get a stroke?
Stroke has got, like you rightly said, there are both the ways that stroke can develop. It can be immediate,
Okay.
or it could be gradual. So the ones that are immediate, these are very difficult to actually catch on.
Okay.
And the response has to be very quick from the relatives or the caregiver to rush the patient to the hospital, see that the initial assessment is done quickly, and the team has to be really, be active and prepared for this kind of thing. If it is gradual, then yes, there will be some early signs and symptoms which we can discuss.
So what would be those signs and symptoms? And before you answer that questions, we will have another question just related to the same about the early symptoms.
Yes.
It's from Jyoti D'Souza from MAPSA.
Okay.
I am Judith D'Souza. I'm from MAPSA, and my question is I want to know what are the early symptoms of brain stroke?
Yeah.
Okay. So, in order to help us to understand in a very clear format, I would like to start speaking from the symptoms from head and down.
Okay.
So we'll start head and then we'll start moving down. The first thing that may appear to the patient who's going in for a stroke, especially developing in the development, there are stages kind of in stroke. So sometimes it develops very slowly, and in these cases you can actually catch on to the early signs and symptoms. Sometimes the stroke can be massive, and it can be immediate, especially in the hemorrhagic kind where the bleeding happens. But in the ischemic kind, sometimes, not always of course, but sometimes it does progress over many hours. It could be even days, sometimes. So it might give you an indication that you're going for it. So some of the early signs could be some kind of heaviness in the head or a headache for simple people. It could be blurring of vision, double vision, okay. Sometimes it could be loss of sensation on one half of the face. Particularly any symptom that's happening on one half of the body has to be correlated to do something with stroke. That's the first thing we do. Why? Because even if it is not, but for the benefit of the doubt, you can save a person from getting into a dangerous zone. Inability to speak or slurring of speech. Your tongue starts feeling heavy. Sometimes you cannot feel the side of your tongue, or you cannot feel the side of the cheek, inside as well as outside. Sensation, arm feels heavy. And one simple test we ask patients to do is to keep both the arms elevated and ask them to close eyes so that they do not have a bias. And sometimes the stroke side starts dropping down. They cannot maintain the power to keep it in par with the other hand or the good hand. So it starts dropping down. That is one simple way that you can detect. Balance issues. A person has never faced this, but suddenly he feels that he's drawing on one particular side. Then sometimes difficulty in passing urine, or any of such activities, toilet activities, difficulty or some abnormality which is something that is unusual, has to be immediately taken into consideration, and that person has to walk to the casualty department. It is like an emergency and you have to treat it like one.
Okay.
And as soon as possible you have to show yourself to a doctor.
So more than often, whenever somebody gets a stroke, in our common parlance or in the society, paralysis zala. That is the common thing which is spread.
Yeah.
But people do not realize or understand the reasons behind it. And as you rightly said, it's sometimes due to lifestyle, and it could because of various other reasons.
Yes.
There are many risk factors, as you mentioned. But is it always that when you get a stroke, your body will go into paralysis?
In most of the cases, yes. Of course, there have been some other unusual variants of that. Okay, sometimes we basically once a stroke is complete, then one particular side doesn't work as normal. We call it hemiplegia.
Okay.
Now hemiplegia, the word plegia means complete paralysis. Hemi meaning half, so half paralysis. So hemiplegia means complete paralysis of one half. Hemiparesis meaning incomplete paralysis or a partial paralysis of one half. So hemi means half. and paralysis meaning a mild weakness, plegia meaning a severe weakness. So these both are actually presentations of a stroke. Sometimes individuals are there with monoplegia, meaning only one limb gets affected. I've seen a very few patients, they have got a stroke and the stroke has been completed, the event is over, and they can walk but their arm doesn't move. Okay. Or their arm sometimes is good but they cannot walk comfortably. So, in those cases we can call it like a monoplegia, wherein one limb is affected more than the other on the same side, which is very rare also.
So basically it is related to the vessels that have got blocked to the part of the body which actually correlate with your brain and your body limbs.
Absolutely. Basically it is actually a vascular event.
Okay.
Stroke is a vascular event. Vascular meaning related to the blood supply. The blood supply, the demand is there but supply is not there. That is a time when somebody can go in for a deficit or a paralysis, what we commonly call as. Okay. And where it affects which part of the brain. Example, there are so many parts of the brain. There are particular parts of the brain that supply the arm. Yeah, certain parts supply the leg, or some part they supply a speech, the face. So it depends where the stroke occurs. Wherever the blood circulation is affected, if that part has to do with the function with the arm, then the arm will not work. Okay. If it has got to do with the face will not work. Or the lower limb, then the lower limb will not work. Something like that. So it is respective to the area that corresponds to function.
So, and when you just told you spoke about the symptoms, the early symptoms of a stroke. So if someone shows these symptoms, is it an emergency, like you have to rush to the hospital or go to a physiotherapist, or is it such an urgency, or can somebody do some home remedies and stay at home?
Definitely this is an emergency. You have to, as soon as possible, rush the patient to the casualty department and immediately get him examined. They might also run a CT scan if the resident doctor on duty suspects a stroke. Okay. Because stroke has a window period of maybe 3 to 4 hours. And within the 3 to 4 hours they have to be able to put the finger on the diagnosis, whether it's a block or whether it's a bleed. Okay. And based on this, whether it's a block or bleed, the medical management will be different for both the conditions. So they cannot do a mistake in that, then they can aggravate the condition.
And is this, strokes can be hereditary also?
There have been some studies that say so.
As you want to answer that question, I'll just stop you there because we have a question from our audience.
Yes.
Just related to that, and that is from Vaishnav Kerkar from MAPSA.
Okay.
Hello doctor, this is Vaishnav Kerkar from MAPSA. I had one question, that what role does the family history play in case of a stroke? Is it hereditary?
Okay,
so is there a family, if somebody in the family has had a stroke, so is it, how much will it impact that? Other possibilities are that you will also get one.
Yes. Now, this kind of a thing is actually called as an unmodifiable risk factor.
Okay.
Because we cannot change the genetic material that we have received. It comes down the lineage, and if there is a predisposition, if the grandparents or the parents have had stroke, there is an equal possibility of an increased chance of getting a stroke. Okay. And we cannot exactly control it. That's the reason why we term it as an unmodifiable risk factor. But then if the person is taking all the precautions necessary, yes, definitely he may be able to prevent it also.
Okay. And with regard to as we were just talking about, going to a doctor. Normally in hemorrhages, it's very clear because you have either had a fall and therefore you're unable to move. And in those circumstances, people normally go to a doctor immediately.
Yeah, which is more obvious.
More obvious.
Yes.
But in the case where you spoke about early symptoms, does every symptom that people who say sensation na, so is it necessary that people should go to a doctor? What would your suggestion be?
We have come across cases wherein people have experienced mild headaches, heaviness, or some kind of giddiness, vertigo symptoms, and they've taken it lightly. and have ended up getting massive hemorrhages. Even some have even passed away. So I do not think there should be any doubt in in answering this question and saying that yes, you have to hurry up, rule out.
Okay.
If there's nothing that's showing up on the CT scan, if your blood pressure is stable, if your vitals are good, if your blood tests are coming clean, then there's nothing to worry. But you got to rule out. It's very important because prevention is better than cure as far as stroke is concerned.
Okay, so prevention is better than cure, and at this point, let's take a break, doctor.
Yes.
And on the other side, we will discuss how physiotherapy can help patients of stroke recover. And there are many more questions from our audience, so keep watching Herald TV. We'll be right back. Welcome back. You're watching Herald TV, and to this special episode on brain strokes. With us today we have Dr. Sheldon Pereira, who runs his own clinic, that is Physiologic, located on the Bambolim Santa Cruz Old Highway, and you can visit him for all your physiotherapy needs. Continuing our discussion on strokes, Doctor, firstly, what role does physiotherapy play in curing a patient of stroke specifically?
Yeah. So once a patient with stroke who has been diagnosed with a stroke is medically managed, that means his vitals meaning heart rate, blood pressure, glucose levels, if they are brought under control, they need to be brought under control first, and then followed by it immediately physiotherapy has to commence. Okay. It could be in the hospital setting itself, it could be in the ICU setting itself, it could be in the step down ward itself, wherever it is, as and when the neurologist or the doctor who's in charge, if he feels that the patient is now ready, immediately physiotherapy should commence. And this physiotherapy should continue even once the patient is discharged and is gone home, till he is able to stand on his feet. It should be like a complete rehab process. Okay. And physiotherapy is going to be one of the mainstay treatments for the person to be rehabilitated, brought back into the society and into function.
So when you spoke about how the body gets affected, the most common visible thing is your body parts, limbs becoming numb. So is there any pain once your body goes numb, can there be pain first of all?
Yeah, this is like a conflicting question, because to some extent, yes, certain sensations will not be felt so good. It could be like fine touch and all is not so very much obvious in this patient. But as a sensation, pain is prevalent. Okay. And we classically see actually pain in the shoulder region. Okay. Either might be because of the way we are handling it, because the arm drops. Usually in stroke, the arm is dropping and it's hanging and it has no control. So the patient has to handle it with his other hand. So sometimes there is malhandling of the hand. Okay. It could be the caretaker, it could be the relatives, it could be the patient himself. Sometimes he turns and slips on that arm. And yes, there could be turning and twisting, awkward movements of the shoulder that may produce some pain, and then eventually many times we see frozen shoulder develop in stroke individuals. Okay. So sometimes arm pain, shoulder pain can be a major reason of distress in the patient. Yes.
Okay. We have a caller, Jonathan. He has got a question for you.
Okay.
Hi doctor, my name is Jonathan, and I had a question for you. I wanted to know how physiotherapy helps in reducing stroke pain.
Okay.
So basically, what I understand is how physiotherapy can help a stroke patient, as well as now related to the question that I asked you, whether if the patient is having pain.
Yes. So most commonly in stroke individuals, we do find shoulder pain as the most prevalent areas of pain. Okay. But sometimes it could be the low back also, because of lying down for a very long time. Okay, or because of inability to move around in the bed or to sit up and to walk, and the patient keeps lying in the bed for a prolonged period, and that itself could be a good reason for a backache. Sometimes people also do get pain in the lower limbs, hip and the knees also, because of again lack of inactivity or lack of movements. So when we do physiotherapy, we are trying to see to that all the joints are mobile, that the muscles are stretched, that the ligaments are positioned in the most optimal position. Okay, and the curvature of the spine is maintained, or the shoulder joint is maintained, because there is no muscle control. So when there is no muscle control and when sensation is reduced, the patient really doesn't know where the limb is. So the sensation or the position of the limb is not understood, and hence there is a possibility that it will remain in a weird position for prolonged hours, and that itself can bring on the pain. So positioning of the patient is done by a physiotherapist. Movement of the joint is done by the physiotherapist, and the flexibility and structure maintenance will be seen by the physiotherapist. So the role is beyond the scope of this discussion.
Doctor, in the recent times, especially now in the post-pandemic situations, if we look, almost every family has gone under stress.
Yes.
People have faced a lot of, especially financial losses.
Yes.
People, kids or youth have missed on to their academics. People have lost jobs. Even staying within the four walls of your house for a long time has caused a lot of them mental stress. So how much does stress become a factor for, or the major cause for a stroke?
So stroke and many lifestyle disorders, they always pivot around stress.
Okay.
So if you put a lifestyle disorder, or if you put a metabolic disorder, or if you speak about a hormonal disorder, everything is pivoting around stress. Stress is one common factor influencing our lives at all the levels, environment, personal, and relationship.
Okay.
And hence definitely this reflects on the finances. So yes, stroke is one of the main reasons that we have to also look out for and keep it under check.
Okay. So we have a caller, Kashmira Kerkar from Tuve. She has a question for you.
All right.
Good evening. I'm Kashmira Kerkar from Tuve. My question is, what are the best exercise for stroke patient?
If you can actually, it's not possible to demonstrate all the exercises, but some of the exercises that if you could speak as well as possibly demonstrate.
The foremost thing, when we talk about exercises is that mostly after a stroke, the patient is mostly bedridden.
Yeah.
The first thing that you can do is make the patient sit. He should be sitting, meaning his limbs must be, knee must be bent at the edge of the bed, rather than sometimes you just lift the patient up and make him sit upright. That's not the best. The best is to take his feet out, let them hang over the edge of the bed, let him be seated unsupported. If need be, you support him with your hand. But he shouldn't be, some people give back rest and this rest, so the patient is in a supported sitting. It's okay in the initial couple of days, but then later you should be able to introduce some challenges in the sitting position. The sitting position is going to be the first step that the patient will be oriented to a vertical position. His blood pressure will be stabilized in a vertical position. Then the circulation will start moving downwards, so his heart will have to work a little hard in order to pump to the upper portions of the body. So we are kind of pushing him into a position to prepare him for standing and for walking. Okay. So sitting is one of the most important activity or position that you can start, and it's a part of physiotherapy. But in some individuals wherein if you cannot avail a physiotherapist, at least try to make the patient sit, because that's really going to work wonders.
And what kind of basic home exercises one can look forward to, which can help a stroke patient?
The limbs have to be moved.
Okay.
At least 20 repetitions in a day, shoulder, elbow, and wrist. The shoulder has to be moved up and down, and then the elbow has to be moved up and down, wrist, opening of the palm, and stretching out of the fingers, movement of the hip and the knee, bending it and then straightening it down. So these are some of the basic things that have to be compulsorily done, at least 20 repetitions in a day.
So if I say, going back to your school days where you used to do PT on Saturday morning for half an hour, so doing that, those kind of exercises would be the best possible way to help a stroke patient.
Yeah, basically to start with, then the patient is not going to have his muscle control is not there. Voluntary control we call it, the voluntary control is not there. So by the time the voluntary control develops, we have to passively get it done. Passively doing movements meaning I have to do it on the patient or the relative or the caretaker or the attendant, whoever is available. Sometimes physiotherapists may not be always be available on the call. So, but somebody has to be trained to do these basic movements. They're very simple movements, very basic movements. But as the patient starts improving, he will require more advanced physiotherapy, which will be given by a neurophysiotherapist.
Doctor, we have another question. Audience, Sahil Mahale from Pedne, he's got a question for you.
Okay.
हॅलो डॉक्टर, हांव साहिल महाले उलयतां. हांव एक्चुली पेडणे गोवा हांगासून उलयतां. म्हाजो एक क्वेश्चन आशिल्लो की सपोज आमी कितें ब्रेन रिलेटेड सर्जरी करता जाल्यार ती केल्या उपरांत की आमकां कसली फिजिओथेरपी ट्रिटमेंट घेवपाची गरज आसा आनी सपोज घेतले जाल्यार ताचो कितें यूज आनी कितें फायदो आसा हेच्या बद्दल विचारपाचें आशिल्लें.
So not specifically about stroke, but then any surgery related to your brain. So post-surgery physiotherapy basically.
Yeah, many stroke patients, especially hemorrhagic strokes where the bleed is massive and causing what we call as a midline effect, wherein they're compressing the structures on the other side of the brain also. They will definitely require some surgical intervention. Okay.
Correct.
And yes, physiotherapy again remains the mainstay or the most important rehabilitation process after a surgery. And the approach will be not much different. It will be very similar to that in a stroke, but we may have to take additional precautions to see that the blood pressure doesn't spike when therapy is going on. So we might require more constant like supervising and more monitoring of the vitals like the heart rate, the respiratory rate and the blood pressure.
So in this case, like especially the hemorrhage part of it, unless and until somebody undergoes a surgery, the threat to life is always there.
It depends. Like in hemorrhage, if only if it is really massive.
Okay.
Yeah, the size of the bleed like will be determined by the CT scan.
Okay.
So the CT scan will tell us the size of the bleed. Based on that and the effect on the patient's outcome, the neurosurgeon will decide, if surgery is not necessary that every hemorrhage will go in for a surgery. But after surgery, yes, physiotherapy is a must.
Okay. One very, it's again a question which is not related to strokes per se, but we have something nowadays called WhatsApp doctors. Why I'm specifically mentioning WhatsApp doctors is because for any previously we used to say, the auntie in the locality or the vicinity. So you just go ask, "Are taka eka vatin odल्या भशेन जाता." And but nowadays, because of the technological developments that we see, and everybody sharing WhatsApp messages and social media, Google, how far one should be dependent on these when you see early symptoms?
WhatsApp messages and social media is doing its part by educating the people in a way. So it has its positives, but like when it comes to like consultation, it has to be with a professional, and it has to be done in a way to rule out any major issues. So it's like stroke is a very serious topic. It's a life-threatening like topic. One of the leading causes of deaths all over the world is stroke actually.
Okay.
Yeah, so we have to take it very seriously. If anyone experiences early signs and symptoms, numbness, like difficulty in like seeing, feeling while eating, the taste has altered, or having difficulty in like moving their limbs, headaches, vertigo, they need to check it up with a specialist. It's always better to go to a doctor and get it done.
Okay. As we move towards the end, this is one very different and very important question, but related to physiotherapy. And we have Dr. Poonam from Pune asking this question. Okay.
Hello, doctor. This is Dr. Poonam from Pune. My question to you is, does physiotherapy work only on the physical aspect? Can it also help with the emotional or mental health of the patient?
So this is, that's the reason I said it's a very different question, because normally we talk and think about the physical aspects of the patient.
Yeah.
So in this case, not just stroke, any problem, so to say, how can physiotherapy help a patient in those circumstances also from emotional side?
Dr. Poonam has brought it out very well. Being a doctor, she must have faced this and she must be knowing about it. Like one thing that I would like to bring up here is that after stroke, many patients who have been through stroke, they do experience emotional disturbance or emotional lability. So sometimes they are sad, sometimes they're excited, and it goes up and down. So as far as physiotherapy is concerned, we spend a lot of time with the patients. So basically an average session is for 45 minutes. Easily goes to 45 minutes is like the base actually, you know. It can go to even 1.5 an hour depending on the rehab protocol. So we spend a lot of time with the patient. We develop a very strong rapport, and that's the place where we start forming strong relationship. And I think that's one of the best ways that we can even cater to people's emotional needs. In a fast-pacing world like ours, there's nobody who has time. There's nobody available to speak. There's nobody there to share. Sometimes physiotherapist, as he comes to do the therapy part, he gets to like really mix up with the patient, and there's a lot of sharing of ideas and feelings, and I truly believe that we can influence a person's emotional well-being through physiotherapy. In fact, I have been doing it for the last so many years.
Okay. So, well, because it has been about strokes and we have had such a serious discussion today, going into the depths of how physiotherapy could help, do watch Herald TV for more on Dotor In The House on Sundays at 11 a.m. And you can watch the repeatedly on our social media platforms, on YouTube as well as Facebook. Next Sunday, we will come to you with yet another episode of Dotor In The House, and this time we will have an ophthalmologist, an eye specialist from ASG Eye Hospital, Dr. Chandra Prakash Oli. And the topic for that episode will be freedom from glasses, LASIK, and laser vision correction. So send in your queries if you have any for that, and if you have queries with regard to physiotherapy, with regard to stroke, and you are still having questions in your mind, please visit Physiologic and meet Dr. Sheldon Pereira, and he shall help you and guide you with all your physiotherapy needs. That's all for today. Thank you for watching Herald TV. Keep watching Herald TV for more on Dotor In The House and our rest of our programs. Until we see you next week, take care of your health. Goodbye.